So the exam is going to be 100 questions. A lot of it looks like it's going to be pretty straightforward, relatively BLS. Take your time, read the question, and answer the question that's being asked. It seems to be popular the last couple days of people who I've encountered in other classes as well, who are just like, my problem is I read the question and then I answer what I think the question should be. So don't do that. Just make sure that what you're the question that you're answering is the one that's actually being asked. So generally, whenever I do these review sessions, somebody takes notes because it will be like a list of things, and then they post the notes in a Google Drive, and then you collectively work on it as a class, so that you have like a really thorough review sheet. So I'm going to throw that out there as a recommendation. But okay. All right, so some things that you should know. You should probably know the different axes of the body, right? So you have the vertical axis, horizontal axis, all those different planes. You should be able to define all of those. Different positioning for your patients, right? So you have Trendelenburg, you have lateral recumbents, left and right. Those are things you should also be able to define. That you should be okay with. Triangles of the neck. You should know which triangles of the neck are which. How many parts, basic parts of a cell there are, and what the centrioles do. You should know the differences between each strain classification. Thank you. Okay, so there's certain different levels of strain, or sprains and strains, right? They're degreed based on certain signs and symptoms. You should know the difference between those. This one I'm going to give you a little bit extra help for. You should know that if a patient has a popping sound in their or feeling in their knee, that it's their meniscus. The meniscus, like the actual information regarding the meniscus, is in like a little teeny tiny side box in your A&P textbook. I would highly advise finding that and looking it over so that you know the differences between which meniscus is potentially going to be injured more likely, or has a more likely to be injured. If a patient has suspected cerebrospinal fluid coming out of their nose, what has been fractured? You should know the opening in the skull that the spinal cord comes out of, what that's called. The signs and symptoms of a Achilles tendon rupture. Hold on, I'm reading it. Signs and symptoms of compartment syndrome. What does the medulla oblongata do? Which is also, what was it? Waterboy. I think we learn more about, in general, we learn more about the medulla oblongata from Waterboy than we did from our A&P textbook. That is. How long is the trachea? Acid-base balances. Okay, what it means when the end tidal is elevated. What does it mean when the end tidal is low? Kind of determining if it's respiratory acidosis, respiratory alkalosis, metabolic acidosis or metabolic alkalosis, okay? That's going to be something that you're going to see throughout the course, not just in A&P. They love those questions on the state test. So just keep that in mind. We're going to cover that a bunch in class, and it's really essential in the airway respiratory unit as well as just in general. Know the difference between oxygenation, respiration, and ventilation. Know the definition for the mediastinum and what organs live in the mediastinum. What causes jaundice? What syndrome will cause a patient to have white fingertips when they're very cold? Understand what cellular actions are active versus passive. If you are experiencing a pump, like an electrolyte pump, that those tend to expend energy, whereas things like osmosis or diffusion are energy free. They don't actually expend. It's just a natural occurrence. Different types of immunity. Okay, so adaptive, acquired, cell-based, you should understand the differences between those. That's going to pop up a couple times. What does the spleen do? I had a long conversation about spleen the other day, which is strange. Yeah.
What does the spleen say?
Quack, 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 quack. Barriers against bacteria and other microorganisms entering the skin. Okay. Parts of a neuron. Strokes. Okay, if you have a patient who has a deficit on the right side, where is the injury most likely? Excuse me. You should be okay with that. That one should be fine. Know your adrenergic receptors, right? Your alpha and your beta, and what alphas do versus what betas do. Okay. What is the outermost layer of skin? You should probably know all the layers of the skin. That's the popular one. Here's a silly question that you're going to be asked. What are the 3 parts of the fingernail? It's going to serve a lot of purpose for you here in paramedicine. Classifications of burns. Okay. First degree, second degree, third degree, and or, superficial, full thickness, partial thickness. You should know the differences between those. Know where your abdominal organs live, right? In the quadrants of the stomach. You should know where those live. One of the main secondary issues of an abdominal injury. You should get that one. That should be pretty easy. Parathyroid glands. How many do you have? Signs and symptoms of a patient with Cushing syndrome versus patient with the signs and symptoms of Addison syndrome or an Addisonian crisis. You should get that one. without an issue. Signs and symptoms associated with DKA. Signs and symptoms associated with diabetes insipidus. Things that the urinary system does. This one you should probably get without issue. Urinary system again, organs of, and all of the other pathways between. Which gland releases follicle-stimulating hormone and luteinizing hormone? Blood vessels and nerves of the penis. Where do they run? It's a question. Jeez. Which I think is really more, in the grand scheme of things, is really more testing you understanding the difference between dorsal, ventral, lateral, anterior, posterior, like what those directional words mean. Those are two basic questions that you should get. Which area of the tongue senses bitterness? The part. Go away. My husband's being an asshole. I apologize. Opaque covering of the eye. What is that called? What part of your ear senses linear acceleration and deceleration? You should know the difference between glycolysis, glyconeogenesis, anabolism, and catabolism. You should know the differences between those. Organic compounds that participate in normal metabolism. Oxidation. Understand the definition of that. Those are two questions you should get. Again, remember, your planes of the body. Understand your different lines, right? Your mid-axillary, your anterior axillary, mid-clavicular. Those are a lot of those directional questions come up. Know the difference between flexion and extension. Another question regarding which abdominal compartment organs are located in. Okay, so again, just review your where everybody lives inside the abdomen. Patient positioning, right? We talked about that already. Trendelenburg, Fowlers, semi-Fowlers, supine, prone. Know the definitions of all of those. That's basic BLS stuff. It shouldn't really extend your brains too hard. You shouldn't have to spend too much time on that. Cell division, some high school biology stuff. Division of the nucleus. Normal division of the nucleus, not division of the nucleus into gametes. That's two different processes. We talked about that already, right? Remember, you should also be able to define the difference between osmosis and diffusion, as well as filtration. What does a cell membrane mostly consist of? Chemicals that break down into ionic conductors. What are those called? Know the different types of epithelial tissues. Know the differences between your pleuras, or the the membranes that cover your organs, right? So you have the visceral and parietal membranes, right? Know which one's touching the organ and know which one's touching the cavity. Know the differences between those two. Also knowing things like your word roots, right? Like pleura is lung, cardio is heart, renal is kidney, like kind of just have a general understanding of those because that's going to help you eliminate a lot of wrong answers when you're taking the test. Signs and symptoms of peritonitis. Know the difference between osteocytes and osteoblasts. Review your types of fractures. Where does the pituitary gland live? Know the difference in the bones in your hand/wrist, right? So you have your carpals, your metacarpals, and then your phalanges, right? So carpals are in your wrist, metacarpals are your hand bones, and then phalanges are your finger bones. It's the same for your foot, right? You're around your ankle or your tarsals. Your foot bones are your metatarsals, and then your toes are your phalanges. Clear watery fluid coming out of the nose after a head injury. We talked about that already. There's two questions. One of them asks of what the suspected bone fracture is. The other one gives you the suspected bone fracture and asks what the fluid leaking out is. Use your test to your advantage. Okay, so if you have a total brain fart, one question will give you the answer to the other question. Know the difference between kyphosis and lordosis? Tendons connect muscle to bone. Ligaments connect bone to bone. Know the difference, okay? Very important. If you have a hard time remembering, just remember that your Achilles tendon connects your calf muscle to your heel, okay? If it's not a tendon, there's no muscle involved. It's just like right ACL, major football injury. There's such a ligament, it connects bone to bone. It doesn't have a great blood supply, so it takes a long time to heal. Just remember that that's the differentiation between those two, okay? Types of myofilaments. What is the part of blood that carries oxygen? Smooth muscle versus striated muscle versus skeletal muscle. Back muscles versus not back muscles. It asks you for, one of the questions asks you which muscle is not a back muscle. Okay? If anyone's ever been to a gym, ever, you should be okay. If they are asking you to examine a eye injury and they want you to do extraocular movements, that's how you assess, right? Your patient's following the finger. The special properties of cardiac muscle, okay? There's three that makes cardiac muscle unique to any other muscle. You should understand those. Hard palate versus soft palate. Lobes of the lungs. Which one has more lobes than the other? Tidal volume versus vital capacity versus residual volume versus inspiratory capacity. Know the definitions of those. What is the glottis formed by? Oh, there's no sweetener in that. Bleh. Where does the trachea divide? What's that called? Exhalation versus inhalation. Which one's active? Which one's passive? Components of a good radio report. Alpha versus beta. Again, know that one. That one's also going to pop up a lot in your respiratory and cardiac modules. Okay. Difference between your absolute refractory period and your relative refractory period. Difference between systole and diastole. What hormone causes tachycardia? All right, if a patient cuts 2 fingers off, how many arteries have been sliced? What do white blood cells do? Chronotropic versus dromotropic versus inotropic. Know the differences. That's another one that's going to give you a huge boost in the future. When we do cardiology, those 3 are super important. About how many liters of blood does the human body contain? Thoracic duct, where does that empty into? Lymphatic organs, how many sets of lymphatic organs make up the tonsils? What type of pulp is in the spleen? What does the thymus do? We talked about that one already. You should know the medication name for epinephrine. You should also kind of generally understand how certain infectious diseases transmit, right? So if I was to say Hep B, that's primarily bloodborne. If I was to say like the flu, that's droplets, right? So you should kind of have a general knowledge of your main infectious diseases that we deal with here in EMS. There's one that we get screened for every year that you should all be familiar with. And that pretty much sums it up. Do you guys have any questions?
I do. After you said if a patient cuts 2 fingers off, how many arteries have been sliced? There were 2 different things you said. You said the next question was chronotropic versus inotropic, and there's one other thing that you said that I missed.
Chronotropic, dromotropic, inotropic.
And the questions that you said that that you didn't go over, are those just really, really basic that everyone should get it right?
Yeah, that's like 8th grade sex ed, general health education questions that you should be fairly knowledgeable on, like female hormones versus male hormones. I will send you a link. It will be posted to YouTube. I have a YouTube channel. So you guys will get the link to that in your email, and then if you want to subscribe, when I do lectures, I will record them and post them to YouTube as well for your ability to review if you want. You're very welcome. Any other questions before I let you all enjoy the rest of your day? All right. Good luck. As I said, I highly recommend putting together a single Google document. This is what my last class did, and they were very successful in completing a very thorough review sheet. So basically, they created a single Google Doc, allowed everyone in the class to have access to it, and everyone started working on different questions or the different points that I make. And giving the information there. It just makes it a lot easier for people to not have to necessarily review every single thing. You find, I'll take questions 1 to 5, someone else does 5 to 6, or 6 to 8, or something like that, and just finding the information, citing the textbook page in there usually works out really well, and I find that a lot of people find other information, especially when you start getting into other chapters, that really kind of improves how well you understand everything, as well as really engages with you with the material, because that when you start getting a little bit later into the class, you're going to get a little tired, which is normal. But once you start finding stuff that you're really interested about, it helps, keep you motivated. Oh, well, that's very nice of him. So, yeah, and if you guys want, you set up another Zoom outside, Google Meet, whatever you guys want to do. If you want me to come pop in, please let me know, and I'll jump in if I'm free. All right. All right, guys. So if there's no other questions, hope you have a lovely day. This will be posted as soon as it processes, and that's it. That's all I have. All right.